Hello everyone, I'm Dr. Shagufta working at Health and Hijama Clinic, Banaswadi, Bangalore. Blood pressure is the pressure of blood pushing against the walls of your arteries. Arteries carry blood from your heart to other parts of your body. Your blood pressure normally rises and falls throughout the day. Blood pressure is measured using two numbers. The first number, called the systolic blood pressure, it measures the pressure in your arteries when your heart beats. The second number, called the diastolic blood pressure, it measures the pressure in your arteries when your heart rests between beats. If the measurement reads 120 systolic and 80 diastolic, you would say 120 over 80 or write 120 by 80 mmHg. Normal blood pressure level is less than 120 by 80 mmHg. No matter your age, you can take steps each day to keep your blood pressure in a healthy range. High blood pressure, also called hypertension, is the blood pressure that is higher than normal. Your blood pressure changes throughout the day based on your activities. Having blood pressure measures consistently above normal may result in a diagnosis of high blood pressure or hypertension. The higher your blood pressure levels, the more risk you have for other health problems such as heart disease, heart attack, and stroke. Your doctor can diagnose high blood pressure and make treatment decisions by reviewing your systolic and diastolic blood pressure levels. High blood pressure usually has no warning signs or symptoms, and many people do not know they have it. Measuring your blood pressure is the only way to know whether you have high blood pressure. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, such as not getting enough regular physical activity. Certain health conditions, such as diabetes and having obesity, can also increase the risk of developing high blood pressure. High blood pressure can also happen during pregnancy. High blood pressure can damage your health in many ways. It can seriously hurt important organs like your heart, brain, kidneys, and eyes. The good news is that in most cases, you can manage your blood pressure to lower your risk for serious health problems. High blood pressure can damage your arteries by making them less elastic, which decreases the blood flow and oxygen to your heart and leads to heart disease. In addition, decreased blood flow to the heart can cause 1. Chest pain called angina, 2. Heart attack, which happens when the blood supply to your heart is blocked and heart muscles begin to die without enough oxygen. The longer the blood flow is blocked, the greater the damage to the heart. 3 is heart failure, a condition that means your heart can't pump enough blood and oxygen to other organs. High blood pressure can cause the arteries that supply blood and oxygen to the brain to burst or to be blocked, causing a stroke. Brain cells die during a stroke because they do not get enough oxygen. Stroke can cause serious disabilities in speech, movement, and other basic activities. A stroke can also kill you. Having high blood pressure, especially in the midlife, is linked to having poor cognitive function and dementia later in life. Adults with diabetes, high blood pressure, or both have a higher risk of developing chronic kidney disease than those without these conditions. There is only one way to know if you have high blood pressure is to have a doctor or other healthcare professional measure it. Measuring your blood pressure is quick and painless. Talk to your healthcare team about regularly measuring your blood pressure at home, also called as the self-measured blood pressure monitoring. High blood pressure is called the silent killer because it usually has no warning signs or symptoms, and many people do not know they have it. Well, many people with high blood pressure can lower their blood pressure into a healthy range or keep their numbers in a healthy range by making lifestyle changes. Talk to your healthcare team about it. Getting at least 150 minutes of physical activity each week, about 30 minutes a day, 5 days a week, and not smoking, eating a healthy diet, including limiting sodium, that is the salt, and limiting alcohol, keeping a healthy weight, and managing stress. In addition to making positive lifestyle changes, some people with high blood pressure need to take medicine to manage their blood pressure. Talk to your doctor right away if you think you have high blood pressure, or if you have been told you have high blood pressure but do not have it under control. By taking action to lower your blood pressure, you can help protect yourself against heart disease and stroke, also sometimes called as cardiovascular disease or CVD. If you have high blood pressure, you may wonder if medications is necessary to bring the numbers down, but lifestyle plays a vital role in treating high blood pressure. Controlling blood pressure with a healthy lifestyle might prevent delay or reduce the need for medication. Here are a few amazing lifestyle changes that can help lower your blood pressure and keep it down. 1 is lose that extra kilos and watch your waistline. Blood pressure often increases as weight increases. Being overweight also can cause disrupted breathing while you sleep. That is called sleep apnea, which further raises the blood pressure. 2. Exercise regularly, because regular physical activity can lower high blood pressure. It is important to keep exercising to keep blood pressure from rising again. As a general goal, aim for at least 30 minutes of moderate physical activity every day. 3. Eat a healthy diet, because eating a diet rich in whole grains, fruits, vegetables, and low-fat dairy products and low in saturated fat and cholesterol can lower high blood pressure. Potassium in the diet can lessen the effects of salt or sodium on blood pressure. The best source of potassium are foods such as fruits and vegetables rather than supplements. 4. Reduce salt or sodium in your diet. Even a small reduction of sodium in the diet can improve heart health and reduce high blood pressure. The effect of sodium intake on blood pressure varies among groups of people. In general, limiting sodium to 2300 milligrams a day or less. However, a low sodium intake of 1500 mg a day or less is ideal for most adults. 5. Alcohol. Limit alcohol. Drinking too much alcohol can raise blood pressure by several points. It can also reduce the effectiveness of blood pressure medications. 6 is quit smoking, because smoking increases blood pressure. Stopping smoking helps lower blood pressure. It can also reduce the risk of heart disease and improve overall health, possibly leading to a longer life. 7. Get a good night's sleep. Poor sleep quality, that is getting fewer than 6 hours of sleep every night for several weeks, can contribute to hypertension. A number of issues can disrupt sleep, including sleep apnea, restless leg syndrome, and general sleeplessness, which is called insomnia. Let your doctor know if you often have trouble sleeping. Finding and treating the cause can help improve sleep. 8 is reduce stress. Long-term or chronic emotional stress may contribute to high blood pressure. More research is needed on the effects of stress reduction techniques to find out whether they can reduce blood pressure. However, it can be hard to determine what causes stress, such as work, family, finances, or illnesses, and find ways to reduce stress. Avoid trying to do too much. Plan your day and focus on your priorities. Focus on issues you can control and make plans to solve them. Avoid stress triggers. Make time to relax. Practice gratitude, because expressing gratitude to others can help reduce stress. 9. Monitor your blood pressure at home and get regular checkups. Home monitoring can help you keep tabs on your blood pressure. It can make certain your medications and lifestyle changes are working. 10. Get support. Supportive family and friends are very important to good health. They may encourage you to take care of yourself, drive you to the doctor's office, or start an exercise program with you to keep your blood pressure low. My patients tell me that they do not have a history of hypertension or high blood pressure and have never had any symptoms of high BP. But still, when they are checked, they usually have high blood pressure. They themselves are shocked to know that they have elevated blood pressure levels. This is when I advise them that along with all the measures to lower the blood pressure, Hijama or cupping therapy is one of the best of all treatment forms which can lower or control your blood pressure effectively. Hijama is one thing I would definitely like to recommend to all my patients who are struggling to control the blood pressure either with medications or without medication. So that's it for this video. I hope my video was informative and has helped you in understanding how to control your blood pressure naturally without medications, including the natural treatment called Hijama. If you have more doubts or questions on this, please feel free to write down in the comment box below. See you in my next video. Until then, stay happy and stay healthy. Bye-bye.